All right, before we even start today, I need to run a quick security verification on you.
Oh, really? Are we checking IDs now?
Yeah, I'm checking the listener's ID, just making sure you are not a malicious bot trying to infiltrate the deep dive.
Yeah.
Let me just check your Ray ID. Looks like it's A111C49 BBD 417651.
Wow, very specific.
Yep. And, okay, Cloudflare clearance is good. You are verified human. You may proceed.
Well, I mean, it's fitting, right? Because we are doing a human verification today. The topic we're exploring is it's a very distinctly human rite of passage.
Exactly. We are talking about wisdom teeth.
Yeah, the dreaded third molars.
And it comes with so much baggage, like if you go online right now, you just see a wall of those viral videos, people waking up from anesthesia, crying over nothing, where they've got those massive bruised chipmunk cheeks.
Oh, yeah, it looks totally
It
terrifying.
looks like a nightmare. So for this deep dive, we are using a survival guide. It's straight from the clinical team at my Gentle Dentist at Brookside.
Right, which is a great resource.
Yeah, and our mission today is basically to take those viral, fear-inducing myths and compare them directly to modern clinical facts. So if you, or maybe a teenager in your house, are about to go through this is your ultimate survival guide.
And we really need it. This topic is just completely shrouded in, like, unnecessary dread.
For sure. Oh, and if you could actually see the high-tech anatomical 3D map of a human jawline that our expert has pulled up here in the studio, you'd be amazed. It looks like a digital command center.
Yeah, it's pretty slick. It really helps visualize things because, honestly, a lot of that dread you mentioned, it stems from this first major misconception.
Right.
The myth of inevitability.
Yes. The idea that literally every single person walking the earth is doomed to have their wisdom teeth pulled. Like, it's just a tax you pay for growing up.
Exactly.
But if you actually look at the biology, that isn't true at all, is it?
Not at all. It's a fundamental misunderstanding of what these teeth are. Wisdom teeth are just your third molars. That's it.
Just normal teeth.
Yeah, they're the last set of grinding teeth at the very back of your mouth. And typically they try to emerge or erupt, as dentists say, between the ages of 17 and 25.
Okay.
So the biological reality is actually pretty simple. If you're lucky enough to have a jaw that's large enough to hold them and they come in perfectly straight, you keep them.
Wait, really? You just keep them forever?
Yeah, they just become a normal, functional part of your mouth. No surgery needed.
Okay, let's unpack this. Because the majority of us, I feel like, do not have that perfectly accommodating jaw.
True. Most of us don't.
I always picture wisdom teeth as, like, incredibly late guests crashing a party.
That's a good way to look at it.
Right. Like, the living room is absolutely packed. It's standing room only. Everyone is super comfortable in their specific spot. And then right at the end of the night, 4 more people show up at the front door demanding to get into a room that is already at maximum capacity.
Yeah, they just try to force their way in.
Exactly. But here is my question, and I think a lot of people listening wonder this. If those late guests are just standing on the porch, meaning, if these teeth are still under the gums and they aren't hurting yet, why not just wait and see what happens?
Oh, wow. Yeah. That wait and see approach is arguably the most dangerous misconception out there.
Really? Just waiting is dangerous.
Absolutely. Because what's fascinating here is the mechanics of what actually happens when that room is too full. It brings us to the concept of impaction.
Impaction.
Yeah. When your jaw isn't big enough, those late arriving teeth, they don't just politely stop growing. They keep trying to push their way into the party anyway.
Aggressive pressures.
Very. They get stuck beneath the gum tissue or they grow in at an angle. And sometimes they even grow entirely sideways.
So they were like actively pushing against the teeth that are already there.
Exactly. And this is where the hidden damage happens. When an impacted wisdom tooth pushes against the roots of your healthy second molars, it triggers this biological process called pressure resorption.
Pressure resorption. That sounds bad.
It is. Your body basically registers that constant, unnatural pressure, and its own cells, they're called osteoclasts, start dissolving the bone and the root of the healthy tooth just to make room.
Wait, seriously, your body starts eating its own healthy tooth?
Yes, it's just a biological response to sustained pressure. It's trying to relieve the tension.
That is wild.
And it gets worse. If a wisdom tooth is partially erupted, like it's just barely broken through the gum, it creates this tiny flap of tissue over the tooth called an operculum.
Operculum.
Right, and that flap acts as a microscopic trap. Food particles and bacteria get stuck under there, and your toothbrush physically cannot reach it.
Oh, gross.
Yeah, it leads to a localized chronic infection called pericoronitis, and in really severe cases of complete impaction, fluid-filled cysts can actually form around the crown of the trapped tooth inside your jaw.
Inside the jawbone.
Yes, quietly hollowing out the surrounding bone.
That is horrifying. And you're saying none of that necessarily hurts right away?
Often it doesn't hurt at all at first. So if you just wait for the pain, well, by the time you actually feel it, the structural damage to the rest of your jaw, or the root of that adjacent molar, is already done.
Wow. Okay, so that's why the Brookside sources emphasize that waiting for a crisis is just a terrible strategy.
Exactly, you have to be proactive.
Okay, I am thoroughly convinced. Leaving them in to wreak hidden havoc is a terrible idea. But that brings up the next massive hurdle, right?
The surgery itself.
Yes. Knowing they need to come out doesn't make oral surgery any less terrifying.
Yes.
There is this deep-seated anxiety people have, I have it too, that the dentist is basically just guessing.
Right, like they're going in blind.
Yeah, people imagine this archaic scenario where the dentist is blindly digging around in the back of your jaw, just hoping to find the root of the problem. It feels inherently violent.
Well, the visceral fear of the dentist is very real. And historically speaking, extractions actually were a much rougher, more exploratory procedure.
Right, like 50 years ago.
Exactly. But that image is incredibly outdated today. The clinical reality from the Brookside team is that the guesswork has been entirely eliminated.
Because of advanced imaging? We are talking about x-rays, right?
Yes, but not the standard ones you get at a regular checkup.
Okay, because those little cardboard things they shove in your mouth are terrible, but they don't seem like they show enough.
Right, those standard ones are called bite wings. They're great for spotting a cavity on the top of a tooth, but they only give a very localized, shallow view. For wisdom teeth, modern clinics use something called an OPG X-ray.
OPG, which stands for?
Orthopantomogram.
Okay, I'm just going to stick with OPG. How is that fundamentally different?
Well, an OPG is that big machine that slowly rotates entirely around your head.
Oh, I've seen those. You bite the little plastic stick.
Exactly. It captures a two-dimensional panoramic landscape of your entire jawline, upper and lower, all in one continuous image.
So they see everything.
Everything. But it goes way beyond just seeing the teeth. The OPG maps the exact angle of the roots, the density of the surrounding bone, the location of your sinus cavities.
The sinuses, too.
Yeah, above your upper teeth. And crucially, it maps the exact pathway of the inferior alveolar nerve running through your lower jaw.
Now, why is that specific nerve so important to map out?
Because the roots of your lower wisdom teeth can grow incredibly close to it. Sometimes they even wrap around that nerve.
Oh, wow.
Yeah, so if a surgeon went in blind and pulled a tooth that was tangled with that nerve, it could cause permanent numbness in your lip and chin.
That would be awful. So by using the OPG,
They see exactly where the nerve is. If it's too close, they might alter their whole surgical approach. Because they have this crystal clear map, they only recommend removal if they definitively see trouble. And they know exactly how to execute the extraction safely.
it is literally like a high-definition GPS system for your mouth.
That's a perfect way to put it.
Instead of trying to figure out the terrain as they go, they have turn-by-turn directions mapped out before you even sit in the chair. And logically, if they know exactly where they're going, the surgery becomes faster, right?
Faster, much more precise, and it involves far less cutting and trauma to the tissue.
Which I imagine directly reduces the pain of the procedure itself.
Precisely. Less trauma equals less pain. And that transitions perfectly into how modern clinics handle the actual experience in the chair.
Because that's the scary part for a lot of people.
Right. The Brookside Guide emphasizes this concept of tailored comfort under the umbrella of gentle dentistry. They don't use a one-size-fits-all approach to sedation because, again, they know exactly what the physical procedure will entail beforehand.
Which is great because honestly, my anxiety level in a dentist chair is usually just through the roof.
And they account for that. If the OPG shows it's a straightforward extraction and the patient is relatively calm, they might just use profound local anesthesia.
So just numbing shots.
Yeah, the area is completely chemically blocked from sending pain signals to the brain. You stay awake and alert, but you feel nothing beyond a slight pressure.
But what if I just completely panic? Like the thought of the pressure and the sounds of the tools, I can't handle it.
Then they step up the pharmacological approach. They offer stronger sedation options like twilight sedation or deep IV sedation.
So you just go to sleep.
Essentially, yes. You're placed into a deeply relaxed, sleep-like state. You have no awareness of the procedure, no memory of it afterward, and you just wake up when it's done.
That is so much better.
The foundational goal here is that fear of pain during the procedure should never be the reason you avoid preventing long-term jaw damage.
That does lower my blood pressure a bit, I won't lie. You go to sleep or you just chill out completely numb for a bit,
Yeah,
and the anatomical problem is solved.
exactly.
But, and this is the big but, the surgery is only half the battle. Because once the clinical team does their precise high-tech work, they send you back out into the wild. And this is where the survival guide actually becomes a true survival guide.
Yeah, if we connect it to the bigger picture, because modern 3D plan surgery is so precise and minimally invasive, the timeline and success of your recovery shift almost entirely away from the surgeon.
It's all on you.
It's directly in your hands. How you manage your body's biological response at home dictates whether you heal in a few days or suffer for weeks.
So let's break down rule number 1 in the guide. It's all about the first 72 hours. This is the critical window, right?
It absolutely is.
You have to dedicate 72 hours strictly to rest. No heavy lifting, no running errands. But the most important physical intervention you can do during this window is applying ice packs to the outside of your cheeks.
Yes, because the body's natural physiological response to any surgical trauma is acute inflammation.
Meaning swelling.
Right. Blood rushes to the site to deliver white blood cells and healing factors, and that causes the tissue to swell up.
And that swelling is what causes those massive viral video chipmunk cheeks everyone is so afraid of. So the ice is basically tricking the body.
Well, it's not tricking it, it's constricting it. Applying ice to the face causes vasoconstriction,
Which means?
the narrowing of blood vessels. It physically limits the amount of blood and fluid that can pool in the facial tissues, keeping the swelling localized and totally manageable.
Okay, so if you stay ahead of the inflammation with ice in those first 72 hours, your recovery is exponentially more comfortable.
Exactly. Ice is your best friend.
Okay, so rest in ice, but what you put inside your body during this window is just as critical. And this brings us to the post-op diet.
The fun part.
Yeah, right? The guide is very clear on this. You must stick exclusively to cool, soft foods. Things like smoothies, mashed potatoes, yogurt, and lukewarm soups.
Honestly, as someone who loves food, I'm going to go insane eating lukewarm mashed potatoes by day 2. It sounds completely miserable.
I mean, it requires discipline, undoubtedly.
So here's my pushback. Let's look at the mechanics of this. Let's say it's day 3, okay? I am craving something solid. If I have a wisdom tooth extracted on the back left side of my jaw, why can't I just take a tortilla chip or a bite of a spicy taco and chew it exclusively on the front right side of my mouth?
Ah, the one-sided chew.
Yeah. If I keep the food away from the hole, how does that hurt anything?
It is a logical question, but it fundamentally ignores the reality of the oral environment. Your mouth is a dynamic, constantly moving, wet environment. It is virtually impossible to isolate food to just one quadrant.
Right. Things migrate.
Exactly. And the clinical warnings against crunchy, spicy, and hot foods are rooted in the biology of the healing tissue.
Okay, break down my taco example. What's the problem?
Let's start with extreme temperatures. If you eat a slice of hot pizza or a hot taco, the heat causes vasodilation.
The opposite of the ice.
Right. The blood vessels at the surgical site open up, which can immediately trigger secondary bleeding from the wound.
Okay, so no hot cheese. What about the spice?
Spicy foods contain compounds like capsaicin, which act as severe chemical irritants. You have raw, vulnerable, highly vascularized surgical tissue in your mouth right now. Exposing that raw tissue to capsaicin will cause an intense, burning inflammatory response that actively delays healing.
Ouch. Okay, so spice is out. And the crunch.
The crunch is perhaps the most dangerous part.
Really? More than the spice.
Yeah. A piece of a tortilla chip or a hard taco shell can easily splinter. Those tiny, sharp fragments mix with your saliva, they migrate to the back of the mouth, and they can physically embed themselves into the open surgical site or the healing gum flap.
Oh, man.
Yeah, the tissue must remain completely undisturbed by extreme temperatures, chemical irritants, or sharp textures if you want it to rebuild properly.
Okay, that makes perfect sense. I will not try to outsmart the healing process with a one-sided taco.
Good choice.
I will stick to the smoothies. But while living on smoothies sounds simple enough, how you consume that smoothie brings us to the absolute, non-negotiable, most critical rule of this entire deep dive.
Yes, the golden rule of wisdom tooth recovery.
Do not use a straw.
Okay.
Throw the straws away. You are making yourself a delicious, perfectly cool smoothie, and your muscle memory is going to tell you to grab a straw. You cannot do it under any circumstances.
And understand why this rule is so fiercely defended by dental professionals, we need to look closely at the histology of bone healing.
Let's get into it.
When a wisdom tooth is extracted, it leaves behind a deep, empty socket in the jawbone. Almost immediately, your body works to fill that void by forming a dense blood clot.
But this isn't like a regular scab you get on your knee, right? It's different.
It's much more complex. This clot is a highly structured matrix of fibrin, platelets, and white blood cells. It acts as a biological scaffold.
That's protecting everything underneath.
Exactly. It seals the socket, protecting the raw alveolar bone and the highly sensitive nerve endings underneath from being exposed to air, food, and the massive amount of bacteria naturally present in your saliva. But more importantly, this clot is the literal foundation that your body uses to eventually grow new bone to fill the hole entirely.
Okay, so you have this delicate, incredibly important biological bandage just sitting in a hole in your jaw. Here's where it gets really interesting.
Yeah.
The bathtub drain analogy perfectly illustrates the physics of the straw here. Think about what a straw actually does. When you wrap your lips around a straw and pull liquid up, you are creating a localized vacuum inside your mouth. You are generating negative pressure.
Yes, the intraoral pressure drops significantly.
Using a straw after this surgery is exactly like pulling the drain plug out of a full bathtub right when you need the water the most. That intense suction force acts like a physical vacuum, and it will physically rip that delicate protective blood clot right out of the socket.
It just pulls it right out.
Yeah.
And the clinical consequence of dislodging that clot is a condition known as dry socket or alveolar osteitis.
And everything I have ever read says dry socket is pure agony, like worse than anything.
It is a profoundly painful reality. When the clot is gone, the underlying bone and nerves are directly exposed to the harsh environment of your mouth.
Just wide open.
Wide open. Every breath of air, every sip of water hits those exposed nerves. It completely halts the healing process and causes acute radiating pain that travels up the side of the face all the way to the ear.
Wow.
Patients consistently report that the pain of a dry socket is far more agonizing than the pain of the impacted wisdom teeth ever was.
All because of a piece of plastic and some negative pressure.
Pretty much.
So the ultimate takeaway from the Brookside clinical team to avoid this entire nightmare scenario, just use a spoon.
It really is that simple. Bypassing the straw and using a spoon entirely eliminates that negative pressure.
Eat your smoothie like it's soup, people. It's not worth it.
Definitely not.
So let's synthesize everything we've covered in this deep dive. If we build this survival guide from the ground up, first, don't let the viral myths and the fear of the unknown dictate your health. The wait-and-see method is a gamble that just allows hidden damage to hollow out your jaw.
Very true. Second, take advantage of modern imaging. Get an OPG X-ray to map the terrain, locate the nerves, and see exactly what you were dealing with before it becomes a crisis.
Get the GPS.
Exactly. Third, if you do need surgery, take those first 72 hours seriously. Rest, use ice to forcibly constrict the swelling, and eat your cool, soft foods, no matter how much you crave a taco.
Stay strong.
And finally, whatever you do, respect the blood clot. Throw away the straws and stick to the spoon.
It is a fundamentally sound, scientifically backed blueprint for avoiding unnecessary misery.
And speaking directly to you listening, if you or if your teenager are starting to feel that dull, persistent ache in the back of the jaw, the best, most proactive step you can take is to go get a clear picture. Do not wait for the party to get so crowded that the walls literally start breaking down. Get the imaging, understand the biology of what is happening in your own head, and take control of the situation. You know, looking at all of this, the evolutionary shrinking of our jaws, the advanced 3D technology we now use to map our anatomy, and the biological precision required to heal, it raises a fascinating long-term question.
Oh, that's that.
Well, if our jaws are so consistently too small to accommodate these third molars, and we now possess the technology to map the exact trajectory of tooth growth down to the millimeter in children, could future dentistry evolve beyond just surgical extraction?
Meaning we wouldn't have to pull them at all.
Right. Could we reach a point where we accurately predict a space deficiency and use, say, genetic or mechanical therapies to gently guide the expansion of the jaw during early childhood development?
Oh, wow.
It makes you wonder if the very concept of wisdom tooth removal might become a bizarre historical relic for future generations.
Yeah, that is an incredible thought to chew on.
Carefully chew on.
Right, with the front teeth. Imagine a future where we don't even need a post-op survival guide because we've actually corrected the evolutionary glitch before it happens. But until that day comes, you have the clinical facts, you have the technology to map the terrain, and you know the exact biology of how to protect yourself during recovery. So ice those cheeks, respect the healing process, and keep those straws entirely out of your smoothies. Catch you on the next deep dive.